you.
Hello and welcome to everyone as you're coming through. We have some folks still joining us and flying through cyberspace here joining. So we'll just give everyone a minute to get on and we'll get started in just a moment. Okay. It looks like we have our initial folks here and people have been able to get in. I see some more people in the waiting room, and Christina, do you mind keeping an eye on that for us as we get started? Great, thank you. Well, welcome everyone. Thank you for being here today. This is our very first Veteran Oral Health virtual road tour stop, and we are starting here with Montana. So we are thrilled that you are all with us as stakeholders in Montana for oral health, and particularly veteran oral health that we're going to talk about today. So we can go to the next slide and we'll get started. My name is Elizabeth Flannery. I am the Director of Education and Leadership here today. We're going to be talking about veteran oral health in Montana, and we will start with a national overview of veteran oral health and then move into some more specifics about veteran oral health in Montana. And we'll have that discussion not be our entire time. We want this to be a conversation between all of us here today, again, as your very important stakeholders for oral health in your state. So we will move into a discussion after our presentation from Annalise and then share some next steps with you. So we can go on to some housekeeping tips. We just want to let everyone know that this session is being recorded. We will post this information after, so you'll be able to share out with additional partners. Slides, forms, and materials, again, will be available on the website. Please share your name, your email, your organization in the chat. Introduce yourself. And if you have any questions, please pop them in the chat, and myself or my colleague Christina Lesk or my other colleague Rahel will answer. We can go to the next slide. So with us today, we have Annalise Cawthron, co-founder and executive director of AIDPH, myself, and Crystal Spring. We want to say a big thank you to Crystal for being our partner on this and really connecting us with all of you stakeholders in Montana. A big thank you to Crystal and Smiles Across Montana. Go to the next slide. And before Annalise jumps into her presentation, we want to start with a poll. Rahel's going to take a moment and launch a poll for you all. We really want to hear from you about what you think veteran oral health priorities areas are in Montana. So we'll just pause for a second and let everyone give an answer to that. You should be able to answer more than one. So let us know and we will take a look and share out. I see some pieces coming through: policy advocacy, integration with general health care, access to care. Okay, it looks like we still have about half of our folks more need to respond. So I'll give another couple seconds here. And Annalise, I can actually, since you're sharing slides and you probably can see this as well, I will pass it over to you to get started, and you can let me know if you want me to share what I'm seeing on the poll here, if you want to share it after.
Perfect. Yeah, I'll hop into reflection just to give 4 more people the opportunity to vote if you haven't. So hi, everyone. Thank you so much for being here today. We're incredibly excited to share this pit stop on our virtual road tour supporting veteran oral health throughout the 50 states. We're excited that our Montana stakeholders are here and invested, and we'd love to learn from you as we go through today's material. Just a little bit about AIDPH in case you're new to us and haven't heard about us or our work. We are a 501c3 nonprofit. Our mission is empowering our community to advance oral health through science, education, and advocacy. Thankfully, today's topic kind of spans all 3 of those areas, so we're really excited to share that programming with you. And this ultimately achieves our mission of a justice-oriented oral health system. Here at AIDPH, we focus on 4 core communities who are chronically underserved, marginalized, historically excluded, and otherwise oppressed through the healthcare system, and in particular in the oral healthcare system. That includes veterans, people living in rural communities, LGBTQIA+ people, and disabilities, people with disabilities, along with the intersection of those particular areas, particularly disabled veterans, or people living in rural areas who are also LGBTQIA+. We also want to thank our partners, CareQuest Institute for Oral Health. We began this work with CareQuest quite some time ago, and we're actually very excited to continue this collaboration, having been so fruitful and dedicated in our partnership in advancing veteran oral health. Since 2021, we've been working on collecting data, publishing data, and producing resources for organizations like Smiles Across Montana and other states to be able to leverage the work that they're already doing into more success and create a more evidence-based framework for the work that we're all doing collaboratively to advance veteran oral health. These are today's learning objectives. In case we didn't say at the top of the hour, just a recognition that we are providing continuing education units, and you'll be able to request those at the end of today's session. We don't have any disclosures. And now I'd like to hop into our veteran oral health overview from a national perspective. So I'm going to share the results of the poll. And it looks like what the top priority areas for this group indicated access and integration with general health care, which I'm actually pretty excited to see because as you're indicating these priority areas, this very closely aligns with the information that we'll be talking about today. And again, our goal here is to listen to all of you and hear the work that you're doing, as well as understanding how we can support your work moving forward. So again, I'm starting with a national overview, and some of this might be a review for people who are in this work all the time. But what I have found working with veterans for as long as I have is that most people actually don't understand the medical benefits and the dental benefits, frankly, including veterans. Many veterans don't even understand the eligibility process and what's available to them through the VA. So that's where we like to start, is with an understanding of the current available benefits to veterans through the VA. So those benefits, what care you can get, how much it costs you, and where you're able to receive care is actually determined by Congress. So that is ruled through Title 38, where eligibility for medical, dental, and other primary care benefits are all determined through federal code, and that can only be changed with a vote through Congress. And along with a change in that vote, there has to be funding to be able to expand those access to benefits. So a change to the federal healthcare system as it relates to VA dental care often requires federal legislative action. Currently, most veterans are not eligible for dental care through the VA. So that top row of people represents all 20 million veterans currently living in the United States. And the lightest half of them are the half that receives care outside of the VA or are otherwise not eligible for care through the VA. So as we move along to the left, the darker blue folks represent the almost 10 million veterans who are getting care in the VA currently. So of that 9 to 10 million veterans, just that tiny, tiny little blue and red area represents the number of veterans who are eligible for dental care. What this translates to is veterans are walking into VA healthcare appointments, maybe to get their medical care, have their primary healthcare needs met, and they're walking out with dental pain or other dental conditions that they cannot have corrected within the VA because they're simply not eligible for that care. So of the 1.5 million that are eligible for dental care through the VA, a small percentage, about a third, are actually receiving or utilizing the dental care because there are unmet needs, there are barriers to access, and frankly, most, as I said, some of our research indicates up to 42% of veterans don't even understand their dental benefits and if they are eligible. So this perpetuates a really inequitable system where veterans are not eligible for care, are experiencing a fragmented oral health care system that really challenges their ability to get high quality and equitable care. And we know this is exacerbated by chronic disease conditions. So veterans in particular with heart disease and diabetes experience a higher rate of dental issues. Unfortunately, what we also see is that veterans with those high risk, high cost conditions are more likely to lose all of their permanent teeth, even if they are experiencing dental visits within the past year. So even among those veterans who are accessing dental care and are able to visit a dentist, they're still receiving some of the worst oral health outcomes. And that's because these chronic disease conditions really aren't managed in an integrated care environment. Again, the VA is the largest integrated healthcare system in the nation. And so the VA is actually the best positioned and poised to be able to meet the chronic disease conditions and the complex medical and healthcare needs of veterans, but most veterans are not eligible for dental care through the VA. So I'm presenting some of our research that we released, maybe not last year, maybe it was the year before, but I'm presenting somewhat recent research by AIDPH and CareQuest, really honing in on those chronic disease conditions, because even after controlling for all of those factors like income and education and rurality, veterans with diabetes were still 40% more likely to be edentulous than veterans without diabetes. Even more scary are our heart disease numbers, where veterans with heart disease were 30% more likely to be completely edentulous and have lost all of their natural teeth compared to veterans without heart disease. And what we want to point out by this is it's not just about these horrible oral health outcomes and poor quality of life and potential overall health impact. This is also a very costly way of preventing or treating chronic disease conditions. And in fact, if the VA would expand dental care to veterans, or if dental care can be managed in the context of an integrated healthcare environment, we recognize that there's a demonstrated cost savings, particularly for those two chronic disease conditions. So some of our recent research that we released last year indicates that for every dollar spent on diabetes care management and dental care, that a dollar is saved through more effective medical management of diabetes as a health condition. Similarly, heart disease, for every $2 spent in prevention and oral health care, for every dollar spent, it's $2 saved. So really at that point, a benefit is paying for itself to cover heart disease and chronic disease condition management within those two places. This will be relevant whenever we talk about what Montana looks like and the chronic disease conditions there. So keep this in mind as we kind of move through today's information. So where am I pulling all of this from? I just want to remind folks that these resources are available on AIDPH's website. So this is just a variety of some of the research and resources that we've pulled together for organizations like yours and throughout the nation to be able to get tangible information about veterans. It's often very hard to find. And in fact, AIDPH and CareQuest have really taken a lot of time and energy not only collecting data with our veteran partners, but any publicly available information through the VA or through national surveillance systems. We've put it into all of these resources so that you have an easier way to access it and use that information, which is one of the reasons why we're doing this virtual road tour. So what I'd like to do is get started on sharing a little bit about Montana and a little bit about why we're doing this road tour. So these are some available resources, again, on the same page where you'll find these research articles. Just a little bit further down are these research articles, but at the very top of that page, you'll find our veteran oral health state profiles. And these were created for all 50 states to give you specific relevant information on what veteran oral health looks like in your state. We've also paired that with the Veteran Oral Health Data Dashboard that should give you state-specific insights. And it's interactive and allows you to look at the data in a way that makes sense to you and explore the insights that matter most. So, what do those state oral health profiles what do those look like for Montana? A little bit about why we put together these state profiles. I believe they're linked in the chat. So we encourage you to pull it up, follow along, ask questions, and determine what this, why this information is showing up for your state. So I want to make sure everybody is able to access those resources. And I will also say, please, as we're going along, add comments into the chat. I want to make sure that I'm pulling out the most relevant information. And I'll say at the beginning of this, I don't have all of the answers. Part of what's important on these and this state road tour to listen and learn from all of you is figuring out what we don't know, figuring out the context behind the numbers from the states who are working in this every day and know their state and their communities best, so that we can learn from all of you, but also so that we can upgrade our resources, so that we can give you the tools that you need to be successful in supporting veteran oral health in Montana. So ultimately, we determined that state profiles were needed because we were getting so many questions about what veteran oral health looks like in my state, in my local community. What does this mean? And can you give us more information and resources? So I will say we've done the best that we can with what we have. Again, data are very limited, but these state profiles are a way for you to get easily accessible information that's visualized and what we hope is sort of tangible and digestible from a variety of stakeholders, and easy to understand and apply. That's the goal. So at the very top of these state profiles is a little bit of context around what's going on in your state, and also just the national coverage of dental care through the VA. We always put that at the top of all of our work because, again, most people really don't understand that veterans are not eligible for dental care through the VA. So if you're approaching a policymaker, a decision maker, a grantor, a funder, the first thing that you can start with is veterans are not getting care anywhere else in the VA. And this is why it's important to the state of Montana, because ultimately states and other healthcare systems bear the disease burden and the access burden and the care delivery burden because of the lack of eligibility and coverage at the federal level. We also went through and highlighted where veterans are positioned in your state. So where are veterans highly concentrated? We also included a lot of information, or what we could find on rural veterans. So veterans are disproportionately located in rural areas. And we already know that people living in rural areas often face a disproportionate burden of disease and disability, struggle with access to care, and have unique healthcare needs just in and of themselves. And so knowing that veterans are often concentrated in those rural areas, it's really important context for state-based stakeholders to be able to make informed decisions about a care delivery path. So first off the bat, we hope to give you some county level insights, knowing that Sanders, Mineral, and Cascade counties have the highest veteran population. And about 36% of veterans in Montana are living in a rural county. Pulling out some state-specific insights here, looking at Montana versus national in a comparison. This is important because sometimes when you present information without context around it, people say, well, is that good? Is that bad? If you're presenting this information to somebody who's a policymaker, maybe even another veteran or a program leader who doesn't understand the context around whether 17% is a high number or a low number, the goal here was to give you a national average to compare to so you can see what Montana looks like compared to national. The other option is to pull other states too. Sometimes states have complementary comparisons, and you would know that by your own state as a stakeholder. And so you can feel free to pull from Wyoming or other highly rural areas and see what Montana may compare to to another state. So all 50 states are available on our website. So I think I primed everybody in the beginning to pay attention to those chronic disease conditions because they are high cost, high risk conditions that can be mitigated through better oral health. And because we made that connection in our research, we wanted to give state stakeholders information on how to present that to decision makers, to stakeholders, and then hopefully make programmatic decisions to address that. So here you'll find information on heart disease and diabetes, along with information like insurance status and indentulism. Again, comparing your state of Montana, to national data. We also ranked each state across all 4 of those important disease conditions or oral health outcomes. So you'll know how Montana is ranked compared to all 50 states. And again, the rankings here are important to realize that number 1 was best or number 1 was worst. So the highest rates of indentulism, the highest rates of diabetes compared to the lowest rates of indentulism or the lowest rates of heart disease. And if you're curious about our methodology, we've also posted that with our state profiles. So if the technical information is important to you, you should be able to access that on our website, and we're happy to answer any questions about that. Lastly, the second page of your state's veteran oral health profile is a report card. And we went back and forth about how to present this information, but we felt like this was a really clear understanding of how to present information and put it in context that most people can understand. Most of us have gotten a report card at some point in our lives, so we understand the concept of what an A or B or C would be and what we would need to do potentially to improve that. So I pulled out some of the information here from Montana, which I would probably argue if it were me in my state. I lived in Texas for a very long time, so I'm a Texas transplant. And when I looked at, and now I live in Illinois, and when I looked at our state, I was still thinking, even if I got an A in diabetes, well, I want to make sure that we're still investing in good prevention, that if we're really doing a good job with reducing our diabetes rates, how did we get there? What are we doing that's so successful? You know, how are our programs really investing in that, and how can we keep doing that work? Where the flip side of that would be, if we're really struggling with insurance rates, if we're really struggling with dental visits, how did we get there? Where are the drivers and the causes of that? What policy levers can I push to make that change, right? And then overall, we have a grade here. As an overachiever and somebody who's a little bit of a perfectionist, if my state were not an A, that's where I would kind of focus. So what can I do to get us to move up in this ranking system? And again, if I were talking to a policymaker or to a funder, it's a really easy way of saying, I want to show impact or movement by changing this. This is a very concrete way of showing where your state is at and how you want it to be improved.
Annalise, I'm just going to interrupt for a quick second.
Yeah, please.
Edith, I believe Edith was asking if we could pause and address something that was back on slide number 23. But Edith, if you could either pop in the chat or chime in and let us know exactly what the question was there, that would be great. And if not, we could come. Oh, I see you're off mute. Perfect.
Okay, there I am. Okay, well, thank you so much for having me, first of all, and also Alex, my manager from Delta Dental. And basically the reason why we wanted to join is, thank you to Crystal for inviting us, is we want to see where there's a need for dentists. So our main goal and purpose to be part of this webinar is to find dentists to provide access to care to the veterans. So that's why I wanted to see, okay, where is the lack? Where is the gap where we can focus on bringing in more dentists to help the veterans? So thank you for this. So I can take a picture and that way I can learn more about Montana. I'm brand new to Montana. So the more information that I'll receive, the better that I'll be able to service Montana and bringing in new dentists to provide access to care to the veterans. So
Oh, thanks so much, Edith. I really appreciate that comment. And what I can say is, it's actually really hard for us to get demographic information or geographic information on where dentists are located in each state, because it's so dependent upon whether each state will release their licensure information, et cetera. But one thing that we do have on our website, and I'm just going to briefly pull us back here on our, and actually this is a, a screenshot of it, is where the FQHCs and VHA clinics are located in your state. So while it doesn't give you a direct understanding of where dentists are, we've tried to give you some understanding of where the access points are, at least in those safety net and federal systems. And that way you can kind of match that against where your state profile is, and perhaps it can give you an understanding of those access points.
Oh, perfect. Thank you so much.
Of course. Thank you for
And
the
I'm
question.
reaching out to you for additional information, if that's okay.
Yes, please reach out to us anytime.
Thank you.
So just finishing up here, thinking about how you can use your state profile. I think I've mentioned most of these use cases already, but just to reiterate, that first one, which I think as I downloaded it into PowerPoint, our spacing got a little bit wonky, so I apologize, but it says veteran advocacy. So first and foremost, advocating for veterans to have improved quality access and affordable care when it comes to their oral health. And that can take many forms. That can be clinical changes. You can talk about best practices. You can talk about individual policies in your state. Maybe that's Medicaid. However that applies to the state of Montana. We hope that we've given you some information to advocate for veterans and for veterans to be able to advocate directly for themselves. Two, educating stakeholders is critically important. If we don't understand the problem, it's really hard to find solutions. And so our goal is to give everybody a mechanism of educating themselves, educating their community, and hopefully making that easy to understand. Third, you can really determine how to drive your next steps. Many of you are already working in this space. And so providing information can help you say, well, this is the path forward that makes the most sense through this evidence, through this trend, et cetera. Lastly, we really want you to be successful in seeking funds, to seeking programming, to seeking resources that will help veterans and their oral health in the state of Montana. So taking these data to decision makers, to funders, and saying, this is really showing us where the need is, and now we can do X, Y, Z and create this impact, hopefully gives you that justification. Lastly, just really want to briefly point out that a success story here, which is our partners in Iowa. They actually developed an entire state of the state for veteran oral health in Iowa. It's an incredibly comprehensive, in-depth report, really going into the specific mechanisms of access and also a whole host of strategic recommendations. And AIDPH was really honored to be able to work with the state of Iowa and developing this report. And so we wanted to give an option for, if you want to take this further, there is, a way forward to be able to get more information, because some states are really working on this to ultimate success. And so with that, I'm going to turn it over to my colleague, Liz, who will help us go through some discussion points. And again, our goal here is to listen and learn from all of you.
Great. Thank you so much, Annalise. And if we can pop over to the next slide, actually, where we have our questions, that would be wonderful. As we said at the top of the call, part of why we're doing the seminar and this work is we really want to hear from all of you who are there in the state, on the ground, what's going on, and your thoughts. So I invite everyone, as we're moving into the discussion portion of our call today, if you're able to, we would love it if you could come on camera, so we can kind of have more of a face-to-face discussion as we go through these questions. And also, please feel free to just come off mute and share your answer. You can also pop it in the chat if you're in a place where you can't come off mute or you're more comfortable with that. So to start us off, again, wanting to hear from you all as stakeholders in Montana about what's happening, we would love to hear about any success stories of veteran oral health policy, programming, or advocacy that's happening in Montana right now. So any success stories you have to share with your fellow folks from Montana, or that, again, these pieces we're going to pull out into a compendium at the end of the year that we'll share across states. And I know a lot of partners are interested to hear about best practices from states. So anything that you think is relevant in either of those pieces.
This is Tonette Hollingsworth, and I'm with the Oral Health Program at DPHHS. I just started about, I don't know, not very long ago, just a few months ago. And so I'm still kind of figuring out where I am. But I have worked on policy issues before, but I don't think in Montana we've really done much related to veterans. I was actually just going in to look to see if we have any metrics that we're tracking. And so I think, having this report, I had already looked at it when it first came out. Having this report is a great first step to really bring attention. So I do have it on my plan for communications to spread this information because I think that's always a conversation starter. And thank you for having this meeting to really propel the conversation as well. But to my knowledge and my past history in the program, we have not really collected much data on the veteran population or done any programming, unfortunately.
We've looked into some veteran services before, and it seemed like there were a lot of roadblocks with the groups that we were going to work with. Like, we couldn't use our mobile capacity. I can't even tell you what it was, but it was something like it had to be brick and mortar. And there were a lot of barriers that I mean, I don't even know where to start with all of that. We had two different groups that were trying to be mobile, and that's really hard when you had veterans from certain areas who couldn't leave their areas. So I'm not really sure what those
I'm not sure if Crystal paused for everyone else. I know she's traveling back from some clinic time, so we might have lost her. So Crystal, if you can hear me, I will say it. You are welcome to come on back and finish your thoughts when your connectivity comes back. And Tonette, thank you so much for sharing those thoughts and those action items. I'm so glad you're on this call and that you're kind of looking at those next steps. I find that really exciting. So before we move into the next piece, I will pause and see if there's any other folks that want to share kind of programming or policy advocacy success that you've seen or pieces that are happening or that you're planning in Montana.
Tonette, can I ask a follow-up question? As you're thinking about the data that are being collected or lack of the data that are being collected, I'm curious if anything comes to mind for you or anyone else on the call about the ways to collect that data, like the access points to collecting that data. So we know it's not being collected, but who do you think should be kind of working on that? I'm hearing the state, where could those data collection opportunities come from based on your experience?
So I formally worked in this program for almost 6 years. And I started a surveillance system based on the Council of State and Territorial Epidemiologists framework at that time. And I think probably our best opportunity that we have for collecting something, and I haven't even looked into it, is BRFIS data, Behavioral Risk Factor Surveillance System. I do believe they collect veteran status, but I've never had the data stratified in that way. I probably will now. And what we've done is about every 5 years, we produce a document that's called the State of the State's Oral Health. And it has basically our whole surveillance system with all the trend data. That's what I was trying to look for what I have on Burfus and what place it might be in, but I don't believe that we have anything on veterans. So, I mean, it's a great opportunity to add to the surveillance system. Other than that, I don't, I have worked in different health department capacities, and getting any data from the VA is very, very challenging. So I don't really see anything coming from there. When you guys did your report, is that where you got your data? Is Burfus data for the edentialism or?
We did. That's the best place to get state-specific data consistently across all 50 states. For the state of Iowa, whenever we worked with them on developing that report, we were so lucky to have state-based stakeholders who pulled not publicly available data, or only by request, to be able to give us some additional county level insights. However, my experience with that report too, and really going in depth in that state, was very similar to what you just described, that they kind of realized, wow, we're collecting all kinds of data and we don't collect veteran status associated with it, and what a missed opportunity.
Well, and I think for Montana, we have a higher proportion of veterans than a lot of the other states. So I think, bringing this to our attention, that it probably needs to be looked at. And even during our stakeholder meetings that I've been part of in the past, I'm not, we looked at a lot of disparities, and I'm not sure that we looked at this group. I was just looking for that document too. So you guys are giving me all sorts of stuff to add to my to-do list.
Tanette, if you're able to drop those links to the surveillance system in the chat, or whatever document you were looking up, we would love to be able to have a look at that. And I'm sure other folks here on the call would be curious too, in case those are new data sources in their state that they may not have used or heard of.
So our surveillance system is not actually public facing. It's just a database that is for the program to pull data from. But we do have, in 2020, they produced State of the State's oral health updates. So I can share that. And in the back of it, it has an appendix with all of the metrics that we track currently. So I will do that.
Wonderful. Thank you again. And we certainly don't want anyone to have an overburdened to-do list, but I'm glad to hear about those action items for sure. And that's actually a really great lead in to the other piece that we wanted to talk about today. Our second prompt for discussion was asking if you were surprised by Montana's state profile and the grading there. And then also, and perhaps even more importantly, talk about data gaps, which I know we just discussed a bit, but that is really one of the biggest pieces we would like to hear from all of you in the state, is thinking through that state profile and the pieces that Annalise discussed. What gaps do you see from your experience on the ground there in Montana, and what should be explored more as next steps?
Well, if I may something. So the main purpose again for Delta Dental to be present in this webinar is to find access to care to these veterans, because what I've learned is that it is a little challenging to bring in dentists into joining the Delta Dental insurance. So I, myself and Alex, we'd like to learn more about what you hear from the providers in Montana, and find a way that it's easier for us to be able to communicate and bring in more dentists to help the veterans. So if you have any dentists that you know of that are willing to help the veterans and that are willing to join the veterans program, that would be great. So that way we can all work together in providing this access to care to the veterans. So if you know of any dentists or anyone that you can connect me to, I would be more than happy to connect with them. And when I say we, Alex and I, we are planning on making a trip to Montana in May and meeting with some of the providers and trying to find the gaps and just trying to find solutions to bring in more dentists to participate to help the veterans. So any feedback, any referrals, anything that you could do for us, we greatly appreciate that.
Edith, can you share a little bit about what your veterans program looks like? Is it for enrollees only, or is it like a, is it just open to any veterans?
Well, the veteran program is mainly for the dentist to join the program to basically take care of their dental needs. And what that is the veterans program, they actually look for dentists that are accepting the veterans to provide dental services. Does that make sense? And so the doctor does not call the dentist directly. So it was the veterans that would call the office to make an appointment for the veteran.
And so
Yeah,
I think my question, oh, sorry. I think my
Sorry, go ahead,
question was
Jeanette.
if it's a donated dental service, or if you're looking for the dentist to be donating services, or if you're looking for services for your enrollees that are Delta Dental enrolled veterans.
Yeah, I think I could add a little bit of context to this discussion. So the role of Delta Dental in helping to service the veterans is we have a couple of different programs that we are supporting. Our dental network supports for the federal government, including like the VADIP program, the VA Dental Insurance Program, and also the Community Care Network, the VA program. So in the earlier slides where we saw about those 1.5 million eligible veterans that have care, that's probably through the VA CCN, the Community Care Network program. And what that program does is it allows veterans who qualify for that to get free dental care, no out-of-pocket cost whatsoever. And everything, the bill is essentially picked up by the VA. So as we're recruiting for these networks, and we do it for a number of states, it's all of Region 4 and Region 5 for the CCN program. So basically everything from Montana down to Texas and west is our territory. So we engage with providers who are maybe in our commercial networks or are out of our network to try to recruit them to join the program so the veterans can see care. All of the care is coordinated through the VAMC, the VA Medical Center, in order to make sure that the veteran gets the care that not only that they need, but they get the medical history. They can coordinate that with the other the med surg side of it, the medical surgery side, just to make sure that there's a holistic engagement with the veteran to get their care. So in Montana in particular, which is an area that is our jurisdiction and we have a keen interest in, we're always looking for dentists who want to be able to participate in that program. And there's a number of changes that are kind of coming up for the program itself that are very exciting. I can't go into gory details about that right now, but we're always looking to add more to the provider so we can make sure that all the veterans have access to care and a variety of dentists in the network to make sure they, the access is there, not only from like a drive time perspective, but also from appointment availability. Because as we know, a lot of the dentists now have a long wait time. And we see this evident in the commercial side. We see this on the federal government program side across all of our networks. And so we're really trying to build in some more access to care and more availability for these veterans to help them. So I'll pause there if there are any questions, but I hope that provides some additional context to the discussion.
Can I ask a question about that? I mean, is that something a mobile program could do also with our dentists?
Yes. So because you mentioned the brick and mortar piece before, and sometimes what the challenges with that is it's more of a billing perspective, and not getting too deep into the weeds here. For when we have a mobile dentistry, because we do Delta Dental as a whole, yes, we do contract with mobile dentists. Is we need some sort of brick and mortar location in which for the claims to be assigned, so to speak, so they can be processed accordingly. So we have a couple more. In fact, I'm talking with one in Hawaii right now. It's really to support CCN on the islands, and so it is something that we can definitely explore if that's something that would interest you.
So yeah, one of the dentists that's coming on with us full time in the summer, he is a veteran, so
Okay, great.
Kind of makes, it's interesting. Thank you.
Oh yeah, absolutely.
Alex, can you share a little bit more about what Delta Dental is doing to bring awareness to the VA DIP program? I know one thing that we've noted in our research when we ask veterans if they even know that program exists, since it was, I believe that was through the Mission Act in 2018, where it was authorized by Congress. And so it's relatively new. And I know a lot of veterans still don't know that it exists. So can you share a little bit more about the work that Delta Dental is doing just to promote that program, and if there's specific opportunities to increase enrollment in Montana?
Yeah. So are you asking about the VA dental insurance program or the CCN program?
Well, any and all of the above.
Any of them? Okay. I can't speak a lot to the VADIP program because I work primarily on the provider side. There's a whole aspect of the member side that has marketing built around it, because the VADIP program is more like a traditional insurance model, and it's almost like the FedVIP program, the Federal Employee Dental and Vision program, where they have a marketplace, and there's a number of carriers that anyone who is eligible can sign up for one of those carriers. It's kind of similar to like what you have in California for the California healthcare. And so for that aspect, there's a whole different marketing push for that, and it's a little bit more, well, it's a little bit more the commercial side. For CCN, it's different. I think primarily the VA is the one that would be making eligible veterans aware of all that stuff. From our perspective on the Delta side, what we are contracted to do through our subcontractor TriWest is to really support the network and get the word out to providers. Getting the word out to the members, that is a whole different kind of section to it. So I don't have a lot of insight there as well. But I know recently, when I say recently, like in the last year or two, there have been some changes to increase eligibility for the veterans. I believe it was called the PATH Act. I have to look it up again. My memory is a little fuzzy on that. But I believe that did help increase some of the access for who's eligible for CCN. I hope that helps. I will go on mute then.
That's wonderful. Thank you so much for sharing and going into detail there. We really appreciate it. And Edith, I know you were asking for a connection in those pieces. And if there's, if y'all have links or publicly available forms, that type of piece, if you want to post those in the chat and or send those to us via email at the end, that would be great for us to be able to share those resources of how folks can connect with you. And I'm just taking a peek at the time. So I know this is a great conversation, and we have a third question. But before we move on to that, I just want to do a pause and see if anyone else wants to share pieces about data gaps that they think should be explored further in Montana.
I wouldn't necessarily just say data gaps. We just have such, we're a big HIPSA state. We don't have enough health providers. I think even medical dental integration is a portion of that, and getting our, if someone has any type of medical or dental appointment, we should be all looking at it from like a health provider lens. So.
Great. Thank you.
Thank you.
And I would just say that, program capacity, the oral health program capacity has been an ongoing problem here in Montana. We right now don't have any epidemiology support. And so data at a state level is really challenging, even to pull like Medicaid data. It's super challenging right now. It's something that I do have on as a long-term goal to build capacity there. But I think that's a huge factor in, the lack of data that we do have right now.
Yeah, that's a really important point. Thank you for sharing that. Okay. Well, I appreciate the sharing, and I will also say, as I go on to our next question, if something occurs to someone and they want to circle back to this and share it, please feel free to do so and or share it in the chat. So the last question that we wanted to ask here during our discussion session was, what resources would be most useful to your role or position in advancing veteran oral health in Montana? And thank you, Edith, for posting your information. That's wonderful. So I'm going to ask that same piece we can discuss here. We can put it in the chat, and we actually will launch a poll as well that gives some options that folks can answer there and we can share out. So Rahel, if you're able to launch that poll, that would be great. So here we have education materials, policy briefs, research findings, training modules, really looking again for us as folks who are trying to advance these pieces about to share to your state, to other states, of what would be useful pieces, as well as us as an organization to develop. But if something else occurs to you, please feel free to share out in the discussion mode as well. It doesn't have to be something that fits into one of these boxes that we've added here in the poll. And let's see, I think we have a comment in the chat. Okay, so Jeffrey says that they just created a mobile dentistry project in Nicaragua, so quite different environment than Montana, and here to learn. Well, that's wonderful. Thank you so much for being here, Jeffrey. We appreciate it.
I think one of the things, like, I mean, when I think of what is really, really needed, because there are programs, there are people who want to do things, but people can't do things without funding. You know, I think funding is the major thing. We, you know, just went through Medicaid unwinding and things like that that are really, really difficult. So there will be projects that our team will show up for, and we've had to say no to so many events recently just because every time we go to an event like that, because we do pay people to work for us, we just can't anymore. We started out doing a lot of great things, and you know, I think funding is a huge piece of it, being able to actually fund it, because for sustainability, you can't rely on just volunteers all the time.
Yeah, absolutely. Completely understand. I would prod you with a follow-up, Crystal, on that funding piece. Are there kind of resources or tools that you, obviously funding sounds simple, but as we all know, can take a lot of capacity. We have to have the capacity to even pursue the funding to build our capacity to do the doing. But that capacity piece aside, are there tools or resources that would be helpful in pursuing that funding that do you think?
Well, I think some of the training modules, because that hasn't been a area we've been in dentistry. So we're in schools and nursing facilities, or you know, people come to some of our events and wait in line. I like that the least, but I'm thinking like training modules, because it is going to be different. And also maybe even dealing and learning more about PTSD and things like that. I think that would be really, really beneficial.
Okay,
Like
great.
trauma-informed care. So, yep.
Wonderful. Well, let's see, we can end this poll here and share the results quickly. Just looking at how we're feeling as a group, it looks like those policy briefs, research findings, then education materials and training modules. So thank you all so much for participating in that. Again, this is helpful to us of trying to be a convener of information, of sharing between states best practices, and also looking as veteran oral health advocates ourselves of where we can focus our time. So thank you for sharing that. And Annalise is going to share next steps. And so if you want to share your slides, I can pass it over to you, Annalise. And as we move into those next steps, we have one last prompt for you. Oh, I'm going to actually pause. I see another piece in this. Let's see, Jessica shared, as a veteran, I've seen the need for care firsthand. Finding dentists who accept the type of insurance or provide free care for vets are a hard find, and funding, like Crystal said. There are just not enough dentists in these rural areas. Yes, thank you so much for sharing that. Workforce for sure is a big piece of the puzzle. So as I was saying, Annalise is going to share out some next steps, and our last prompt for you as Annalise talks through next steps and resources is we would love to, if you could just share in the chat, what is the most important thing you learned today. If you could post that there for us, that would be incredibly helpful. And I think it would be helpful for all the participants on the call as well to see what others took away from this information. And I'll pass it off to you, Annalise.
Thanks, Liz. I'll also add to most important thing you learned today is thanks to any resources. Our goal here as we close out in partnership with Smiles Across Montana is to make sure that we're providing out resources to all of you. So whatever's captured today, please understand that it'll go back to our partners and they'll continue to disseminate information. If there are actionable next steps that AIDPH can support, we're here to do that. So this is just the beginning of the conversation, and understanding the context and additional opportunities is really critical in moving us next steps. So as we mentioned at the top of the hour, CEUs are available. If you are interested in that, if you are not interested in CEUs, please take the survey anyway. It's an evaluation. And you don't have to request the CEU portion, but your evaluations help us understand how to structure sessions moving forward. It also helps capture additional questions as you're percolating throughout your day on what you may have learned or what is useful. We can capture that also in the evaluation piece. Recordings and resources all will be available, so you'll be able to reference these slides later. Obviously, all of the links to both the research, the data dashboard, and the state profiles are publicly available, so those are already ready and out for review and access. And everything that we've mentioned today can be found on aidph.org/veteran health. And in case you missed it, we wanted to make sure that you saw 2 opportunities to learn more. One being our annual colloquium that's coming up in about 6 weeks at the very end of March on community collaboration and oral health and advancing person-centered outcomes in Chicago. There's a heavy emphasis on rurality and veterans, and we fully expect to see a lot of really wonderful programming there. I believe Crystal will be there too. So we really look forward to seeing all of you at that event. We hope you'll join us. It's definitely not too late to register. And we also wanted to just draw some attention to our newest report in collaboration with CareQuest Institute for Oral Health, which is looking at veteran productivity and well-being. So we actually analyzed additional data on the employment impact of veterans. And while this is not state-level insights, it applies nationally to veterans, and I'm sure creates a really important argument for better oral health for veterans as they move through their workspace, their employment, and their ability to generate revenue for themselves and economically in a broad sense. So we hope you'll give that a look. And that's all that we have for you today. We just really want to thank you for your time, your attention, your thoughts, your feedback. This has all been really exciting. And we're so thankful that Smiles Across Montana was able to facilitate this road tour, the stop on our road tour today. So what I'll say is thanks and see you later. And let's please keep this conversation going. And with that, we'll close out. Thank you all.